Eyes are the window of the soul. Your eyesight is one of the most important senses. 80% of what we perceive comes through our sense of sight. On this occasion of World Sight Day, we have with us ophthalmologist Dr. Jyotee Trivedy. So let's welcome Dr. Jyotee Trivedy on SJLive with me, Shubhrika, powered by Crown Paint, celebrating 60 years of being the colors of Kenya. If you like it, crown it. My Facebook page is Shubhrika, my YouTube channel is Shubhrika Johari, and my Instagram handle is Shubhrika Johari. Welcome to the show, Dr. Jyotee Trivedy. How are you?
I'm fine, thanks, Shubhrika. Thank you so much for getting me on the show.
Thank you so much, Dr. Jyotee. On the occasion of World Sight Day, please tell our viewers, why is World Sight Day celebrated?
World Sight Day is an annual day, which is a day of awareness. Basically, the purpose is to focus the global attention on blindness and vision impairment. And it is usually celebrated on 8th of October, which is the second Thursday of the October every year. And the theme for this year actually is Hope in Sight. Every year there is a different theme for the World Sight Day. Hope in sight means in the sight there is a lot of hope and we can do something to make that sight better.
Oh, okay. And how did it start? Who initiated it?
The very first World Sight Day was initiated by Sight First campaign of Lions Club International Foundation. It was in the year 2000 and it has since been integrated into Vision 2020. It is coordinated with IAPB, that is International Association of Prevention and Blindness, with the cooperation of World Health Organization. And it actually brings together all the international NGOs, private organizations, even the public hospitals, public universities, private hospitals together under one umbrella with an initiative so that they can eliminate the blindness.
Okay. And if you would like to know that what all can we do in our daily lives to take care of our eyes. Earlier the population was not too much and people had a relaxed lifestyle and they didn't have any screen time. But nowadays things are very different. You are not going outdoors very much. You are spending a lot of time on screen. So how can we take care of our eyes in these times?
I will just try first with the basic eye care examination. That is, we will start with wearing of UV protected sunglasses, which will have 100% polarization. It will help you to reduce the glare, which will protect the eyes from the UV rays. But it will not be for vision improvement. There is a myth that when you use the polarized glasses that you will get a vision improvement, but it is not so. So you should wear the UV sunglasses. That is very important. The second point I'll say it's to stop smoking. If you are smoking, then please stop smoking. That really causes problems for the eyes because the smoke goes into the eyes and the eyes are always red. Then it is necessary for us to have a baseline eye examination for each and every individual, mostly at least after the age of 40. Whoever are not wearing the glasses, at least after once a year after age of 40. The eye protection, like a safety wear, it has to be worn whenever you are working in a chemical industry, in a lab, in a welding or mechanical industry. So safety wear is a must. The fifth point, I would say that you should be aware of a family history regarding eyes. So everybody should know their family history, like your parents, your grandparents, your brothers or sisters, if they are suffering from any eye problems. That is very important. You should know your eye care provider. This is for the reason being that you cannot look for an eye care provider when you are in an emergency. So you should know your eye care provider where you want to go before in hand. That is always important. Always clean up your eye makeup. That will be these are all the basic eye care points which I'm elaborating on. You should always remove your eye makeup at the end of the day when you are finished with it at night. Look away from the computer screen. I will come to the computer screen time or screen time. That one I will come, I think, is your other questions. So we should look away from the computer screen time. And the other point, the last point would be wash your eyes with the cold water every night. You can splash your eyes with the cold water. Tap water is always cold, and I always tell my patients, please splash them inside the eyes, and it will really soothe your eyes.
Okay. Dr. Jyotee, eyes are one of the most important organs, and there are quite a few simple exercises also, I'm very sure, which can help you to take care of eyes. Nowadays, everybody is talking about yoga, and there is a face yoga, there is eyes yoga. So could you tell us a few good and easy exercises which we could do to take care of our eyes?
So I'll go for some few exercises. I will tell you. The first one I'll tell you on the focus change. You can hold your finger a few inches away. You can hold the finger like this, or you can hold your thumb in front of you, and then you move the finger away by looking at it. So you can move it looking at like this at the finger. Then you move away and look for a moment at a distance, and again come to your thumb and bring it towards you. So that is called a focus change. Yeah, so this can be done at least 20 times a day. So if you're sitting or in front of the TV also, you can do that with the thumb exercise. This is called a focus change. The second one I'll tell you is an eye roll. Eye roll is that you can roll your eye 360 degrees. So you can try and do like this. So it should be up, right, down, left, like that. And you can do this eye roll at least 10 repetitions twice a day, and it is quite good for the eyes, So it will help for the muscles of the eyes which are straining when you are there for the on the screen time or something like that. The third exercise I'll tell you is a palm exercise, which is a cupping of the hands. You can cup your hands, both of them, you can cup them and put them on your closed eyes like this. You see, you can put them on the closed eyes, and when closed eyes, you stare far. So you can stare far under the closed eyes. So you close your eyes, put your palm and stare far, and you will be able to see many hues which turn into black. And you can do this for 30 seconds. Okay. It will really help you. Okay. The other one is eye press. You close eyes, inhale deeply, you close your eyes, inhale deeply, and place all your fingers on your eyes and press slightly on your eyes. You can do this for 10 seconds. You can feel so much soothing after doing that. Okay. The other one is palming. Palming means you can rub your hands together and you can make heat is generated. You see, and in case some people have sweat or something, they can put their hands in the little warm or lukewarm water, make them a little bit heated, the palms, and you can place over your closed eyes for 10 seconds, and you will find that the warmth will go in. And this was usually done, when you used to get some foreign body inside the eye or something, people used to make the warm hands and put like this. So that is called a palming act. Then you can do a figure of it. You should sit in a good posture with your feet which is flat on the floor, your hand straight in front of you, straight with the elbow which is straight, and the thumb there, thumbs up. Keep your head still and look at your thumb. Use your thumb to make a figure of 8. So you can make a figure of 8 like this, when you use your thumb and look at it. And you can do this anti-clockwise and clockwise, at least 5 repetitions a day, and it will really help. These are actually a simple exercises which you can do in the office. You can sit down when you have a leisure time in front of the TV. Yes, that I would say that these are the best exercises you can do.
Yeah, actually, they are very easy. And any diet tips also, Dr. Jyotee, which actually can help?
Yes, Shubhrika. For each and every organ of our body, vitamin deficiency can cause problems. It's not only the eyes, but the rest of the organs of the body also. And it's same for the eyesight. So the belief of eating carrots can improve vision has some truth. Okay, but it's not that, okay, you have some retinal problem and you keep on drinking carrot juice and your eyes will become better. Not like that. You have green leafy vegetables, zinc, lutein, xanthine, and omega-3 fatty acids. These are actually the main vitamins which can be used for us for the eyesight. Then we can have tuna, salmon, eggs, nuts, beans, and some citrus fruits, which will reduce the age-related macular degeneration. So diet is always important for each and every organ of the eye.
And people are usually scared to donate eyes. Could you please throw some light on that? And after one dies, it's very easy to donate the eyes, but there are so many taboos which are attached to it. Could you please tell us that how easy and how beneficial it is?
A very good question, Shubhrika. I'm telling you, and being a corneal surgeon, I'm really campaigning for the eye donation in the society. First and the foremost thing is for the society to create an awareness about an eye donation. What is exactly an eye donation? What do we take out from the eyes basically after? But there has been taboos, as you have said. Mostly there are the religious beliefs and the cultural beliefs. So, but most of our Asian community has been donating the eyes here, because we had started an eye bank some years back, that's 2005, and we have been trying to get the eyes over the donation. The best gift which you can give back to the society after your death is an eye. That's what I say. You can see the world through your own eyes again. I can really throw a very huge light, but I know your interview is short. You can donate your eyes within the 6 hours of your death.
Okay.
And that will be can be transplanted to the another person who is blind, and he can see the world through your eyes. So you can still live beyond your death. That is what I mean. If any other things you would like to know, then I can explain more, because there is quite a lot in eye donation. I feel that people should generously donate the eyes. People have a thinking that after removing the eyes, oh, there will remain a socket, but it's not so. We try to stitch the eyes in such a place and put an artificial eye onto it so that it is not disfigured. The eyes are not disfigured when you are cremating or when you are burying the body.
And how much time does it take? I think just a few minutes.
No, it takes around 15 to 20 minutes to remove the eye.
Okay, 15 to 20 minutes.
Yes.
And Dr. Jyotee, in today's lifestyle, eyes are actually very stressed because of high screen time and less of outdoor activities. So what can be done to relax our eyes during these times?
Okay, you need to make sure, if you have glasses, then you need to make sure that your glasses prescription is up to date. It should have anti-reflective, which is very beneficial for the eyes when you're using a computer screen. The other thing is that you need to do a slow blink. We do not blink often when we are on the computer. We should keep on blinking the eyes so that it becomes lubricated. The eyes, when you blink, the tear films forms and it lubricates the eyes. So slow blink is very important in case when you are on the computer screen. We should look straight ahead, and then you should close the eyes for 1 second. So you close your eyes for 1 second and slowly open them, and repeat this for 20 times. So you will lubricate your eyes more often. Your sitting posture is very important when you are on the computer. Choose a comfortable seat and a supportive chair. You should have a feet which are flat on the ground, and you should have a computer screen which is exactly at the eye level, like the way today. You see, it should be at the eye level of yours, so you're not straining, you're not bending, and your eyes are also not straining. There is another thing which we do for the eyes. That is called a zooming exercise. Basically, the zooming exercise is you should sit on a chair with a good posture, and then you should hold your arms straight with the thumb. Yeah, keep your eyes on the thumb and slowly bend your elbow. The elbow should be bent, and then you bring the thumb towards you. So this exercise is really good for the computer users. So this one is not looking in the distance like the way I told you. You see, for straining of eyes, which I told you before, the best exercises, those are the basic care. But for the computers, you put your hand straight, look at the thumb, and then bring the thumb towards you. So that is how you can repeat this for at least 20 times. The other thing is that there is a 20-20-20. 20-20-20 is every 20 minutes of your computer screen time, you should look 20 feet away for 20 seconds. Simple it is. So it is like 20 minutes, 20 feet away, 20 seconds. So if you, and even then, if your strain doesn't go away, then you should visit an eye doctor, eye specialist.
Okay. And I feel definitely the information you're giving is very much to the point, and it's very important and beneficial for our viewers at this moment. And yes, there is one more thing which is very common. It is cataract. Cataract is very common in old age. How to deal with that?
Cataract is a preventable blindness. So as we grow old, you will get senile cataracts. Cataracts have their own grades. And senile cataracts amounts to almost 99% of the cataracts. The rest 1% are depending on the other causes, like maybe you have secondary comorbidities like diabetes, hypertension, and other diseases which can cause an early cataract. Cataract is very easily operable, and it is one of the major causes of preventable blindness all over the world. And we can operate the cataract whenever it is ready. Usually the cataract is operable when you having the visual difficulties, and it depends on person to person and individual to individual. It is a daycare procedure, and you do not have to stay in the hospital.
Okay, so is operation necessary in cataract, or medicines can help?
No, medicines doesn't help, and you definitely need a surgery for the cataract surgery, like the way we have white hair. Look, even I have got some white hair. Yeah. So you can't do anything about it with aging. So cataract is an aging process. So we have to remove the cataract and put in a new lens there. And there are quite a number of simple surgeries, though it is a major surgery in the eyes, but it is a very simple surgery which each and every cataract surgeon knows. And there are types of the surgeries. Basically, in layman's language, you know, it is known as a laser surgery, but it is called a phacoemulsification. And there are ultrasound waves which disperse the cataract, and we suck the cataract, which we can cut the cataract and suck the cataract and put in a foldable lens. And there is a small incision manual cataract surgery where you can do manual surgery as well. But you need to choose the appropriate lens for the implant, and you need to choose the appropriate surgery for your own case, depending on how.
Depending on person to person, case to case.
And then you will need counseling for that what work you do, what are your requirements after the surgery, how far you want to see, how near you want to see. Depending on that, the lenses are available.
Okay. And yes, we have actually discussed and covered almost all the important points. But one thing, how are you managing your work in Corona?
COVID has changed our perception. Shubhrika, really, it has changed our perception towards the clinical patient settings. Basically, it's the clinical area when you have an hospital based, then it has really changed it. Adjusting to the COVID has become a reality now, and there are a number of guidelines which have been placed by WHO as well. So for the surgeon's sake, I'll tell you that PPE is very important. Surgical mask, that is N95 for the surgeons, face shield whenever necessary, shoe cover, and gloves. These are the most important for the doctors. For the patients, it will be social distancing in the hospital has to be maintained. Plus, the patients should have a mask on, and they should cover it mouth and the nose. Because usually what happens is the patient, when they want to talk, they will pull the mask down, they will start talking. So you have to really put all the notifications on your door and all that please don't remove your mask while talking, and don't talk when you are on your slit lamp when a doctor is examining you. Gloves for each patient entering the hospital is very important. You need to open the doors and the windows of the clinic for the proper ventilation, and there is also usage of HEPA filters. You can have HEPA filters in your clinic which can clean up the air around you as well as the patient. So it doesn't stay there for a longer time. You should not put ACs are not very good. So actually open air is very important. Cleaning and disinfecting the surfaces, instruments, machines which we are using for the examining the patients. Initially, we used to clean and disinfect every 20 minutes. every 20 minutes, and the machines and the instruments after every patient, which still continues. But now the cleaning and the disinfecting we are doing on hourly basis now. Every hourly, handles, the doors, the tabletops, and everything. We also we have to make an arrangement that only one relative can attend while the doctor is examining. The relative is only needed when the child is below 14 years of age, and the elderly patients who cannot speak the language or who cannot communicate properly, then only we allow a relative. Otherwise, the relative is outside the hospital. So these are the basic, I have told you, the whatever the corona times, we cannot stop corona and we have to live with it. So we have to continue your services and you have to continue serving the patients as well as the society.
True. Thank you so much, Dr. Jyotee. And I'm really very happy that you agreed to come on this platform of SJLive. You know, most of the times what happens, we know how the things are done, but we tend to forget it. So I think it's definitely a very good reminder for all the viewers on the occasion of World Sight Day that how we can take care of our eyes and how important organ it is in our body. Thank you so much,
Shubhrika. Thank you so much.
Thank you.
Okay.
So that was Ophthalmologist Dr. Jyotee Trivedy on the occasion of World Sight Day on SJLive with me, Shubhrika, powered by Crown Paint, celebrating 60 years of being the colors of Kenya. If you like it, crown it. Do like, comment, share, and subscribe. My Facebook page is Shubhrika. My YouTube channel is Shubhrika Johri, and my Instagram handle is Shubhrika Johri. See you again with one more interesting topic with some more interesting people.